Hi everybody, my topic for the Share What You Know assignment is solution-focused therapy. The population I chose to research is people suffering with an eating disorder. What is an eating disorder? It's defined as an eating disorder is an illness that causes serious disturbance to your everyday diet, such as eating extremely small amounts of food or severely overeating. Common eating disorders include anorexia nervosa, bulimia nervosa, and binge eating disorder. Anorexic nervosa. Many people with anorexia see themselves as overweight even when they are clearly underweight. Eating food and weight control become obsessions. People with anorexia typically weigh themselves repeatedly, portion food very carefully, and eat very small quantities of only certain foods. Bulimia nervosa is patients with bulimia have recurrent and frequent episodes of eating unusually large amounts of food and feeling lack of self-control over these episodes. The binge eating is followed by behavior that compensates for the overeating, such as forced vomiting, excessive use of laxatives, fasting, excessive exercise, or a combination of all of these behaviors. Binge eating disorder is a person loses control over his or her eating. Unlike bulimia, periods of binge eating are not followed by purging, excessive exercise, or fasting. As a result, people with binge eating disorder often are overweight or obese. What is solution-focused therapy? This is a therapy that is a very goal-oriented, and it targets the desired outcome of therapy as a solution rather than focusing on symptoms or issues that are brought to the client to therapy. It looks at the present and future circumstances and decisions over the past experiences. The worker encourages the client to imagine the future that they desire to obtain, and then they look together to figure out what skills, resources, and abilities a person already possesses that can be enhanced in order to attain the desired outcome. How does it work? It deals with people who are equipped with skills to create changes in their everyday life. Worker is there to help in refining and identifying those skills. The client already knows on some level of what change needs to be changed in their life. It's also they're very clear on what goals they desire. And the therapist will help the client to identify a time in life when a present problem was not there or was more manageable, and evaluate what solutions may have been present at the time. Some techniques that are used for solution-focused therapy are coping questions, an example might be, how do you manage in the face of such difficulty to fulfill your daily obligations? Or this can help a person to see his or her skills in coping with adversity. A miracle question, it helps people envision a future in which the problem is absent. So you're pretty much asking them, if this problem wasn't there, how would your life be and how would it be different? And what would you be doing differently? How the solution-focused therapy affects with the eating disorders and how do you use it? You have the element of surprise. Many of the clients say they start therapy feeling anxious or worried, expecting for the social worker to start digging into the problem and, deal with their past. Usually they are very pleased to find that they're focusing more on their strengths and not dwelling on the problem, and they start building a solution. Another thing that they use is miracle questions. Most clients know exactly what they want to stop, like I said before, but they have not formulated what they would rather do instead. When asked what will be the first thing that tells you a miracle has happened, they come and reply, I won't be thinking about food. And usually the next question the worker might ask is, okay, so what will you think about instead? So using the miracle question can help, figure out how to help them stop thinking about their weight or thinking about their food or anything. Also, exceptions, It's a very black and white viewpoint and a common among the clients' groups. And looking for exceptions helps to challenge them. Like if you the client states that they're always vomiting, and then you ask maybe in a reply when you build a very good rapport with the client, maybe you can say, you know what, really always, you're not doing it right now, or do you do it while you're driving, so you're not constantly doing it. Some problems with solution-focused therapy is a client expecting, like they walk in expecting something very depth therapy and analyze, and that's what they're expecting to do, and they could tend to get somewhat upset through therapy because it's very simple, and for it's hard for them to understand why it's so simple, so that could create a challenge. But that's that, and thank you for listening.